What's up, guys, and welcome to the Dummy Docs podcast. I'm your host, Johnny, and today we're interviewing Dr. Joshua Daniel. Dr. Daniel has over 17 years experience as a medical doctor in the field of neurology. His expertise is all in brain optimization, and today we're going to be talking about the effects of dieting, fasting, and supplementation on the effects of brain health. If you guys like this video, make sure to like, subscribe, and follow for more. And guys, if you like this muscle dummy merch, make sure to check it out at dummysubs.com. Hope you guys enjoy. So what are you doing now?
So I'm doing more of like brain optimization. So I'm taking kind of like the health and longevity and focusing on way to make your mind better, right? So whether it's a performer, whether it's a sports athlete, everybody's looking for like the next in on your brain health and optimization. So like your brain makes who you are is the way I look at it, right? Everything about you, your memory, personality, your judgment, your reaction, your emotions is what your brain is. So for me, when I was in traditional medicine, I would see so many of these people that would be even in their 20s, coming with a stroke or early onset of cognitive impairment like dementia in their early 40s. And there's so many of these things that are preventable. So for me, where I stepped out of the traditional realm was, I'm tired of seeing things down the line, but if I was upstream and I could help these people out, you can really alternate their entire life and pathway.
So how was that transition, from the traditional route of medicine to holistic, more or less? So I saw that, you have 17 years as a medical doctor. You worked out of JFK, Shore Physicians Group. How did you make that change, and what kind of challenges have you faced within the holistic realm of medicine?
It's tough. Honestly, I think that a lot of it starts from education. And, the basic things, even if you see in med school, like most of the lunches were sponsored by pharmaceuticals, right? It was always a medication for potential pathology, but we never looked at the root cause. So for me, that was the yearning to figure out, how I can go back to the basics and figure it out. And it is difficult. I think most of the traditional docs, I would say anybody more like 50 years and older, are still backlogged in education. What they're doing now for patient education is something that was science decades ago. And for someone to go through like vitamin regimen, supplement regimen, like what's your magnesium, what's your vitamin D, are you doing things like walking? Are you doing breathing exercises? I think we're so focused on a script for pathology instead of going back to the basics. And it's tough. I think it's tough to break that traditional mindset in so many of these guys. And just like the healthcare system in itself, I think it's such a Neanderthal system where changing that from the root cause is always an uphill battle, right? We don't really have education in grade school and high school about nutrition. If you go to the cafeteria for your local hospital, some of the things they serve is really outdated. Like, why would you have sick people eating food that makes them sick? So for me, it was like educating people and going back and teaching them the basics. But it's always a struggle, right? Changing people's mindsets is always difficult.
For sure. And I think that's a great point you make about education. That's something that I really try to do for my audience and my patients that I'm treating, although I'm still just started my fourth year of medical school. But really, the education is the biggest gap that we can fill as providers in any sort of field. And obviously, one of the routes that I think is so important is nutrition. And I know that you're also very, you prioritize nutrition with your patients as well. So my question is, how do you treat your patients for this brain optimization? Is it diet-based? Is it fasting-based? Like, what are your protocols that you have your patients do in order to optimize their brain health?
Yeah, I can tell you myself. I was in med school. I was probably like 225 pounds, inflamed, overweight. If I look at my older pictures, you'll see my face is like ballooned up and I was heavy set. I think a lot of that stems from bad education and stress. But for my patients, I want to go into everything they do, starting from sleep. If I work backwards, are they having enough sleep? Because lack of sleep causes increased stress and higher cortisol. What do they like to eat? I go through blood work to see if they're a perfect candidate for intermittent fasting, where some patients are and others aren't. So I want to see what they eat, how often they eat. Are they adding things that they might think are healthy, which are wrong, right? There's some people you want to avoid high glycemic foods, and other patients, they can tolerate it. To how much water do they drink? Do they meditate? Do they sleep? How well is their community setting? Are they socially isolated? So for me, it's really going to top to bottom, but I ask all my patients, and usually my visits are from like 1 to 2 hours. I want to know how many meals they eat, how often do they eat, what they eat, how often do they use the bathroom? Because our gut microbiome has so much to do with our mood, energy, the gut is really the second brain.
Yeah, I'm a firm believer of all of that as well. Personally, how I kind of manage my diet here at home, lots of grass-fed meats, lots of free-range eggs, cheeses, kefir, Greek yogurt, things of that nature, all really to help promote good gut health. Now, one of the things that I'm really passionate about within the nutrition realm is teaching people how to make macro-friendly dishes. So, 1 out of every 3 children in the U.S. and 2 out of every 3 adults in the U.S. are overweight or obese. So there's that whole, tackling that nutrition end in, accounting for socioeconomics and all of these things. So what I like to really try to do is try to show these people how they can make simple adjustments to the meals that they eat on a daily basis in order to help them lose weight, and then to build into a diet that is more gut friendly, that is higher in nutrient density versus what they're typically eating. But again, there's so many things that go into the socioeconomics of it, but that's something I'm really passionate about. Now, you talked about gut health. What are some things that are important for gut health that you think?
Having the right bacteria is the most important. I think many of the foods that people eat really are toxic to the good bacteria that we have. So we have about up to 6 pounds of good microbiome in our gut. And this is like an ecosystem, right? So this interferes or communicates with every single organ, right? Our brain has a lot to do with our gut health. Most of our happy hormone, serotonin, is really produced in our gut, which then affects our brain. So one of the biggest nerves that come off of our brain is called the vagus nerve, which innervates every single organ in our body, but has a lot to do with our gut. So this bacteria communicates with our brain through the nerve, through the neuroendocrine system, and it really signals what we want and what we desire. So many times we might have a craving for certain things is because the bacteria needs that food. So I think getting rid of bad bacteria first, right? Having a systematic analysis of, do I have good bacteria? If there's bad bacteria, how to get rid of it, promote good bacteria and let it grow. And you'll see changes with inflammation. Eating a single meal, people feel bloated right away. They feel gas. You can't really gain all that fat off one meal. It's really microbiome that's causing gas and toxicity inside. Many of the autoimmune conditions stem from microbiome, right? We have things like leaky gut, where things that should be in the colon are starting to penetrate out in microdoses and causes autoimmune conditions. So it's such an integrated system that we're still learning about it more and more.
Absolutely. I was listening to a podcast talking about the positive feedback loop that this bad gut pretty much is. If you're a person who's eating a lot of fast food, that you're feeding these bad bacteria, and pretty much that they have kind of an addictive personality. So as these bad bacteria continue to grow, it has a positive reinforcement that they want that food back. So kind of getting a good management of gut microbiome is super important. You talked about inflammation there. Now, going back to intermittent fasting, I saw that you've posted some posts about intermittent fasting. Tell me your thoughts on intermittent fasting, because I'm a huge proponent of doing it.
I think it's super important. Look, we're humans. We're not built to eat 3 full meals a day with multiple snacks constantly, right? We have to give our gut rest for the rest of the body to heal. And today there was an article that came out in one of the medical journals where we have cells called senescent cells, and these cells just hang out in our body. They've kind of divided fully as much as they can, but they're not doing their job anymore. So for example, let's say there's a liver cell that's just hanging out. It's lost its function, it's lost its capability, but it's just hanging out there. So every time we fast, our body actually gets rid of these dead senescent cells. So it's really good to help clean out our body. We have a level of focus which goes up as well. And the reason our level of focus goes up is kind of like the fight and flight system, the sympathetic parasympathetic system. So it comes back from the caveman era, where if they didn't have a meal, their sympathetic system, which is their fight and flight system, goes into overdrive. And that's why we concentrate more. We have better clarity in thinking when we're doing intermittent fasting. It's one of the easiest ways to help regulate blood sugar. I think it gives us clarity. It helps with brain fog. So it has numerous roles, especially the most important in really getting rid of those senescent cells.
For sure. And I'm also a huge proponent of intermittent fasting. I'm a big supporter of people fasting minimally for 14 hours a day. So obviously this is different between if you're a type 1 diabetic, type 2 diabetic, but the prevalence of obesity and type 2 diabetes in the US is on an upward trend. And I think that one of the biggest issues with the standard American diet is our grazing tendencies. We have a behavior that we're taught really since birth that we have to eat our breakfast, have to eat our lunch, have to eat our dinner. And really, for me, the majority of people that I speak with about the standard American diet, this is what they follow. So a lot of people do fast in a way. They'll skip their breakfast, they'll eat a mediocre lunch, and they'll have their biggest meal at dinner. Now, some of the research that I've panned through really shows that the further back that you can push your fast, the better effects of that intermittent fast. So I like to tell people to stop eating right around 7 o'clock. Don't pick up breakfast till 9 o'clock. And again, this is totally dependent on diabetics, things like that. But really lowering the spikes of blood glucose is really important in helping kind of combat the effects of hyperinsulinemia, which seems to be a new term that physicians really aren't even talking about so much, but it's something I'm super interested in. So what are your thoughts on the high insulin levels and what can we do to combat those?
Oh, definitely. I think educating in foods that are high glycemic index, right? Foods that shoot up sugar instead of very slowly, gradually increasing blood sugar level. So every time there's a spike, you'll see it in a kid very easily. You give them something that's very sugary, like pancakes with maple syrup. They're going to jump around the walls everywhere, right? Super hyper, and then all of a sudden they crash. And that's what happens to our blood sugar because blood sugar increases in our blood, right? Insulin gets secreted out in tremendous volumes to help blood sugar come from outside the cells to inside the cells. Eventually, we keep spiking this blood sugar and we start to become insulin resistant, right? The sensitivity of insulin goes down. So we need to produce more and more insulin to do the same amount of work. So I think that if we decrease the amount of high glycemic foods, the hyperinsulinemia starts to get better controlled. And it's simple. I don't think that people need to jump onto the Ozempics and Manjaros of the world. I think there's certain patients, yeah, for sure they might need it. But we've become a society that if you go back to the basics of simple diet and exercise, you don't need these crazy interventions that most people just want because it's an easy way out. And you'll see that as soon as they get off of it, they rebound the weight back again because they've never fixed the root problem and the root cause.
For sure. And I actually just finished up an endocrinology rotation. Lots of people that are looking towards getting on Ozempic or have been on Ozempic. And I've read some research studies that 2 out of every 3 patients on Ozempic end up regaining all of their weight back. So people constantly message me, what are your thoughts on Ozempic? The problem with Ozempic is you are not changing your life habits around food. And that's the exact reason why it comes back so fast. Because if you're not changing your eating habits of what you're eating, you talked about those high glycemic foods, and talking about high glycemic foods, things like white rice, white bread, sugar, added sugars, trans fats, fried foods, all of these are high glycemic foods, which in other words, increase your blood glucose very quickly upon digestion. So when people hop on these medications, they're not changing their diet, they're not changing their meal frequency, they're not changing their sleep habits, they're not reducing their stress. And all these things really add up when it comes to causing weight gain and inability to lose weight in the long run. But that's something that I have seen on the endocrinology. And Ozempic's such a new drug as well. We're not really sure what the recommendations are regarding when to take people off, how to take people off. So it's pretty interesting, and I will be able to keep up and see how that progresses throughout the years. Now, going back to your brain health, like what are some things in diet when you're having these patient interviews? Like what educational points are you giving your patients on like what foods to eat and things of that nature?
So for me, everything that you bring into the body is important because everything you eat really turns over your cells almost every 90 days plus. So I want to know how much water you're drinking. Are you drinking minerals with it? Our brain's like a battery. It conducts electricity all day long. So like you're sitting there right now, your pupils are enlarging and constricting whether you know it or not. There's a part of our brain that's regulating thirst, knowing should I drink or not. It's regulating our bowels. We're sitting there with a certain posture. Our brain's calculating the way we're sitting. It's testing constantly what our balance system is doing. It's allowing me to think of words to say next and allowing facial movement and expression of my mouth to bring the words out. So the brain's super complicated. So that's why for me, I want to know how much water somebody drinks. We've shown that your cognitive performance will go down with lack of water intake with appropriate electrolytes. I want to know how much food you're eating. So I like to break it down into macros. So I want to make sure you're eating healthy fat. A significant amount of brain is water. A significant amount of brain is fat. There's fat around our nerves, which is called myelin. And you might have heard of term like people might have heard of multiple sclerosis, in which there's a disruption of the myelin, or even people who have certain types of cognitive impairment, you'll see their myelin is destroyed. So healthy fat is very important for the diet. So I like to introduce things like avocado, cold press, first press, single source olive oil. Salmon is really important. Nuts are really important. I want to know if there's a vitamin regimen and plan. For me, important vitamins are a really good multivitamin. Are they taking in omega, which can help offset cognitive impairment? Are they taking in vitamin D? Because there's studies that show that people that are deficient in vitamin D, which really works as a hormone, have a higher incidence of having cognitive impairment. I want to know your magnesium levels. Again, studies have shown smaller brain size with those patients who had a hypomagnesium. So a smaller amount of magnesium has shown in some patients to have a smaller brain size. I want to make sure their protein intake is good. So for me, it's always been 1 pound per ideal body weight. I want to make sure that their carb intake is not something that's going to spike up your blood sugar. Because in patients who have Alzheimer's dementia, we've realized that the immune system is highly regulated and very strong. So blood sugar can accumulate and form plaques in the brain. So in some patients who have early symptoms, I'll tell them, look, go on a keto diet. I think you'll do better. It'll make you more focused. And there's some people I'll say, look, low glycemic diet, meaning less blood sugar, and other people can tolerate it. So for me, it's, diet, meaning water intake, electrolytes, their vitamins, and their macros of the food they're bringing in.
So going back to healthy fats, so this is something that, avocado is superfood, eggs are superfoods. Now the big kind of challenge to that, people often talk about cholesterol levels. So what are your thoughts with cholesterol levels in people who are pretty optimized in their health? Like, does LDL typically is associated with increased risk of heart disease, things of that nature? So what are your thoughts on cholesterol and the challenge that some people may take to increasing things like eggs, avocados, things like that?
So I love eggs. I'm a very boring person when it comes to food. There's one day a week I'll tend to go out, but for me, it's always 3 whole eggs in the morning with some kind of ground beef. And then I'll have a carb just because if I worked out the night before, I'll feel a little bit more weaker and I'll feel I need it. Only 15 to 20% of our cholesterol comes from our diet. Most of it's made by the liver. So I don't always use typical LDL. I like to look at LP little a. I look at other cholesterol molecules. Like I'll do like an NMR lipid profile for blood and just see, if they're making too many cholesterol proteins, or are they having a lot of cholesterol around those proteins. So it's not as simple as one thing leads to another. I think the other problem is where people want to, or providers want to really super regulate their total cholesterol and they drop it down too low. We need cholesterol to build cell walls. We need cholesterol for hormones. So when you drop it too low, you'll see guys come in with, or females come in with hormone abnormalities because they're on a statin medication for such a long time. And I think that most people do not need a statin medication. There are obviously patients that need it, but it's really an old school medication that can cause a lot of harm and disruption. And these patients end up coming in saying they have myalgias, which are muscle aches. Then you'll measure their LFTs, which are liver function tests, and obviously afterward you'll notice that their liver is being affected. There's some patients that'll end up with brain fog. So for me, I'm not really pushy on medications for cholesterol management. I'm okay with a little bit of upper level of normal of cholesterol because I think that the risk with dropping it low will cause other things down the line. But it's really back again, are they exercising and what's their diet like?
Absolutely. And it's something that's pretty prominent when you can take someone who has a pretty abnormal lipid panel, high cholesterol, high triglycerides, maybe an increased hemoglobin A1C. If you simply change their diet, it's the simplest thing that you can do. If you really focus on getting them to adequate meal frequency with good macronutrients, talking about protein, protein is a macronutrient that I think is one of the most important when it comes to weight loss for a few reasons. Number one, and most important in my opinion, is its ability to hold on to lean muscle as you lose fat. So this is really important as we age. As people get older, tendency to lose balance, lose muscle. You want to make sure that you're maintaining muscle as you're losing weight. Secondly, it's also very satious. It helps us stay full. So that's why I'm a big proponent of showing people higher protein recipes in order to not only keep the muscle that they have, but to also stay full and to stay on course. Going back to vitamins and minerals, So what you talked about magnesium, talked about vitamin D. Are there anything else that you want to look at if you're looking at a panel for any of your patients, and what do you think is most important there?
Definitely B12 is really important. I like to look at B1, B6, B12. Other things I like to add for supplements that have shown a lot of promise in animal studies and somewhat in cellular studies are ashwagandha is shown to help with decreasing plaque burden. So that's a really good one. Choline, which is in eggs, has shown benefit to increase levels of acetylcholine in patients, helping with focus and cognition. So I think that's a really good supplement to add as well. But when you look at patients, you obviously want to look at, blood sugar, whether it's glucose, A1C, and also insulin level. I look at CBC and CMP. CMP by looking at all their organ functions, and hormones are another big one. Many people will end up having what we call pseudo-dementia, where they're having symptoms of memory loss, but they don't have dementia per se. They have something else that's causing the memory loss. So many times when, blood work is off or something else is going on, they might have symptoms of pseudo-dementia when the etiology or the cause of it is something totally different.
Gotcha. So, I mean, there's a lot of young people who are really trying to be proactive in their health. They're trying to decrease their risk of developing any neurodegenerative diseases, Alzheimer's, Parkinson's, things of that nature. So what are some basic foundations that you would recommend that, people my age, 25, 30 years old, who want to decrease the risk of having these complications down the road, what would you suggest with them?
Exercise is really important for any neurodegenerative condition. So it's shown before, we used to be like neurologists say, diagnose and adios. And that mindset has totally changed. Exercise has shown what we call neuroplasticity, where you learn to make new connections. And exercise is very highly correlative of that. The more you exercise, and it's not only cardiovascular, it's super important with resistance exercises as well to make new nerve connections. For younger folks, definitely, social circle is very important. CDC made a guideline recommendation saying that being socially isolated as equivalent of a risk factor is smoking 15 cigarettes a day. So
Wow.
Those are some of the rare things I like to look at. I mean, most of us know about diet and exercise, and we follow that, those who are super healthy. But some of those rare things can really, change your health course. Meditation is really important. I love breathing exercises and just your mindset. I think mindset's another thing that many people don't end up chasing for. They focus a lot on social media. I think that's one of the biggest and worst things they can do. Not for things that you do. I think that's very highly educational and I love it. But some of these other things are just dopamine hits of garbage where they're constantly flicking up and up. And it's really garbage that's coming on there, except that's something that's educational, something that you're going to learn from.
Absolutely. And, a lot of people my age, younger, I think this generation growing up on social media, they have it a little bit more difficult just being immersed in the amount of knowledge and information and influence that's out in the world. And that's one of the biggest things that I say to young people, talking to pre-medical students and things of that nature. I feel like everyone has this drive for money, but they don't have this drive for happiness. And I think that's something that's really, for me, I've always wanted to be a physician, and this is not for money. This is an ability to make an impact, and that's what a physician is. It's not for any financial gain. I mean, they'll throw you $300,000 in the hole before you even make any money anyways. So really, if it's for money, I would not recommend it. But that's the biggest thing with me, and especially the younger generation, and even older too, just to find your happiness. Because if you can wake up and really enjoy what you do on a daily basis, you will never go wrong. You'll be rich in that happiness every single day. But it is difficult, and it's difficult having so much information thrown at us every single day of, what we should be eating, how we should be exercising, should we fast, should we not fast, all this information. So I guess you sit with your patients for an hour or two. What does your patient population typically look like? What age, what sex, how does that work?
So it's really broad spectrum. You'll have kids that are older teenagers who come in with, concussions, sport-related injuries. And then you'll have people like yourself who are younger, who are trying to figure out what else they can do to make their brain more optimized. And then you'll have the older population where you'll see early onset of some kind of neurodegenerative condition, whether it's Parkinson's, Alzheimer's, or other type of cognitive impairments. It's a wide spectrum. I would say most of it's probably middle, where people just want to feel more focused and sharper.
Gotcha. So I played football back in college at Ithaca. I've definitely had a concussion or two, unfortunately, just with circumstances of playing that sport. I'd like to know kind of your knowledge, your background on concussions, and how are concussions treated in your field best? How are they treated best?
You know, it's funny. I got a text the other day saying that somebody I knew whose son ended up having a car accident. There was a concern for concussion. I think the most important thing is recognizing early symptoms. So it's not only loss of consciousness, it could be basic things like headache, dizziness, nausea, vomiting, just trouble focusing and brain fog. You know, those are kind of basic things to ask for. And the way I like to do is giving the brain rest, but there's a really fine-tuned area of rest. You want to give it enough rest so you don't get the symptoms, but you also want to progress at the same period of time. So you want to monitor your symptoms and try to push yourself in some sorts, whether reading, assessing your balance. I always try to say avoid electronics because I think that there's a lot of trouble with using electronics, especially with concussions. There's something that I test for called convergence. So convergence is very simple. If I look at this, let's say pen, and I bring my eyes closer to it, my eyes converge. Many patients with head injuries have trouble with convergence. So I usually like to monitor the distance of convergence and where their issue is, and also testing balance studies. Obviously, I always recommend an MRI of the brain, not a CAT scan. CAT scans are, full radiation for one, but they're really good to rule out blood. If I want to see if there's a brain contusion in addition with the concussion, then I like using the MRI modality better.
Gotcha. Now, moving into just TBIs in general, are there any holistic treatments that are kind of on the rise or something that you've seen in the neurology standpoint that, you have used or maybe would consider with patients with TBIs?
Definitely. So previously it was just rest, right? Or sometimes if someone had a headache, they would put them on certain type of class of medications. Very common is antidepressant class of medications for the headache part of it. I think that's changed a lot now with higher education. So, the real role is to decrease inflammation. So very high nutrient supplements, multivitamins, omega is a big anti-inflammatory, turmeric's another big anti-inflammatory, and making sure all the vitamins are there for the brain to do its thing. Other end of the spectrum would be things like hyperbaric chamber. So very well studied, just not very accessible. And I think that's where some of the limitations come from. There's a great doc who studies many boxers, and it's shown that there was an improvement after a TBI in those that went under hyperbaric.
Awesome. Now, going back to the supplements, are there any supplements that you personally take?
Oh, I take a lot. So I would say I take about 60 in the morning, and then I do another 20 in the evening. It's not for everybody. So there's like some biohackers like Dave Asprey who takes, I think, like 120 or 140 supplements. I take a significant amount, but it's not for everybody. There's some patients who'll ask me, look, my max is like 10. I want to make sure it's less than 10. And there's others who'll go all out. I try to back it up with studies to make sure that they're educated on why they're taking what supplements. I like to cycle them. Sometimes I'll go off for a few weeks. Sometimes I'll cycle them by taking them Monday to Friday with Saturday, Sundays off. I think taking supplements every day becomes very burdensome, and sometimes I think it may cause receptor fatigue by giving them too many supplements all the time.
Sure. Like what kind of supplements are you taking?
Oh, I take everything from multivitamin to omegas, vitamin D, magnesium, lion's mane, pomegranate extract, blueberry extract. I like things like other type of mushrooms. There's so many. I have a whole cabinet full of vitamins, and it's usually after my first meal. Otherwise, I get super nauseous, and I have to have it after a meal just for that reason.
Gotcha. So up here in Rochester, in New York, really in the Northeast, short summers, not a whole lot of sun. Got some good sun this weekend. But what would you recommend for someone who is looking to start vitamin D supplement? What would you start for the units? It's always different when you're measuring the levels, but for a pretty basic, someone who just wants to start vitamin D, how much do you think they should be taking?
So best way to get vitamin D is you want to get maximum exposure to the sun with minimal clothing, at least 20, 30 minutes a day. Obviously during the wintertime, that's very difficult to do. And I think some people genetically just tend to convert it a bit less. I've had people in Miami who've had low vitamin D levels. For me, number one, get a blood test to see what your levels are. And for me, it's not always 30 to 100. I like upper limit from 60 to 100. I think good starting off dose is usually 5,000 IUs of vitamin D, but it depends on what your levels show.
Gotcha. Now, besides diet, we talk about diet, talk about fasting, talk about some supplements, talk about some oxygen therapy. What other things do you implement? Would you implement or recommend for neuro health in general? Things like ice baths, saunas, things of that nature.
100%. So I can tell you the way I start off my day is first I like to read something about personal development or something that's going to get my mind going. Other than it's obviously not fiction, but something that's going to help me stimulate my mind. After that, I like to do meditation for like 10 to 15 minutes. I really think that everybody needs it, especially this day and age. I always tell my patients, it's like having a web browser open with 20 tabs. It's hard for us to focus because our mind is constantly going from one thing to the next, and we never kind of shut down. We never relax and we never focus. So meditation really helps with that. It helps to bring clarity, but it also shuts down things that are stressful. And after that, I tend to journal. I think journaling is really important, whether there's goals you want to journal about, or if there's something that's giving you a problem, just journaling about that gives you clarity. I think most people just use a computer all day. Nobody puts pen to paper. And that's a really good therapeutic response, really good therapeutic help. Other things I like to add a lot is for sure after a shower, I'll do a few minutes of cold shower. It really wakes you up, especially if you're tired in the morning. It releases neurotransmitters for sure that's going to help elate your mood. I think it has so many benefits for your health. There's a Finnish trial that shows all-cause mortality reduction by 50% in those that did a sauna followed by a cold plunge. I don't think you need a cold plunge. I think you could use a cold shower. The benefits are still there, but the study was amazing.
I think it was 2,000 men in a Finnish study, and the all-cause mortality reduction is amazing on how some small intervention you can do can make such a drastic attempt.
Absolutely. And, for anyone at home, simply just getting in the hot shower and then turning it cold. And, some people might be a little on the edge of doing it, but it's really, once you do it and you get into a consistent habit of doing it, it really becomes so much easier. And it will get to a point where you might just hop in the cold shower. You might not even need the warm shower. But the effects on the nervous system and our vasospastic changes from vasodilating to constricting, great for overall mortality. Like you said, it's something that's really free if it's accessible here in the U.S. If you have hot water, cold water, it's something that's just a little biohack. So we talked about fasting, dieting, exercise, cold, hot, supplements. Anything else that when you're talking through your hour or two appointment, what else are you talking about? What are you asking them specifically?
So everything about what their current goals are is really important for me. I like to know what their meals are, what their biggest stress factors are, and how they can react to it. What do they do for their stress? What time do they sleep? I think sleep is so important. Studies have shown that lack of sleep accelerates the risk for neurodegenerative conditions. Sleep really helps clean out the brain. Every time we're sleeping, it's called glymphatic system, where I always describe it as street sweepers that come out and really take out the toxins from our brain. So while we're sleeping, we're building new memories, but we're also getting rid of toxins that shouldn't be there. So you accelerate the risk of cognitive impairment when there's a lack of sleep. Studies have shown it's driving like someone who's a drunk driver when your sleep is not optimized. I like to use gadgets, like I use the Aura Ring. I don't like using the Apple Watch at nighttime because I feel constricted. Some people like using that, or they use a Whoop device. But monitoring your sleep is one of the most important things you can do, because you take metrics for everything, right? You take metrics for yourself, for your grades. If there's a business person, they have metrics for, how much they did last quarter. But when you ask metrics for health, people don't use a tracking device. So I think having objective evidence on small changes they make and realize the effect of that is super important. So I like to bring in the sleep aspect. How often do they use the bathroom? To everything, medications they've tried. The studies have shown that people that have been on 5 to 6 medications have a higher risk of neurodegenerative conditions again. So I want to know what they've tried, why they're on medications, and I think people don't even know why they're on certain medications.
And that really goes back to the education thing. And that's unfortunate that I was just on my internal medicine rotation. There's such a high turnover of patients. And when you come in super sick and you're discharged after 3 or 4 days and they start you on all these new medications, it's overwhelming. And especially for the diabetic population who continuously have to check if they check their glucose levels and making sure that's all squared away. So it's a lot on the patient. We want to just make sure that, as we're educating, that we're breaking it down as simply as possible and really making sure that they understand why they're doing it, things that they're doing. Going back to sleep, something that I use to help me sleep is I have an alarm that lights up at 5 o'clock every day that helps me just get kind of acclimated, because that's one of the biggest things with sleep is, patients will come in and say, I'm not sleeping well. And first thing I ask them is, are you going to bed at the same time every night? And are you waking up at the same time every morning? Because that behavior of sleep pattern is so important when it comes to making sure that they're getting adequate sleep and feeling rejuvenated every day. I am currently on my geriatrics rotation, and I have, anywhere from 102 years old to late 60s. And as we get older, the quantity of sleep decreases. So with people coming in with sorts of mild cognitive impairments, maybe they're forgetting their keys, they're forgetting their times of appointments, and they're having a reduction in sleep, how do you go about managing that?
I think many of these people have a problem where they end up taking daytime naps. So they're not stimulated enough. They'll sit down and start watching TV, and they'll doze off for 15 to 20 minutes or even longer. So daytime naps is one of the worst things to do. Other things I like to look at is if they're on any sedative type of medication, are they taking anything throughout the day that's making them tired? Very common are benzos. Benzos are medications for a certain reason, whether they're on there for anxiety or other causes, but increases the risk of dementia, but also messes up their sleep pattern. And I want to make sure that their last meal is at least 3 hours before bedtime, because they won't go into deep sleep otherwise. So I want to look at what they're doing throughout the day. So that's like a really important detailed history.
For sure. And again, talking about meal frequency, you're going to have decreased quantity and quality of sleep if you're eating late at night. And that's something that most standard Americans do eat. They have their largest meal late at night, and then they finish it with dessert right before they go to bed. At least 3 hours minimally before you go to bed should be your last meal. And if not that, stop at 7 or even push it back earlier. It's the simplest thing you can do. So kind of just for, wrap up, what do you practice on a daily basis for your physical, mental, and spiritual health? I mean, you talked about your diet, you talked about your exercise, your supplements, you get in the sun, talk about a little bit more about your breathing techniques, and what can people do to kind of implement these small things to have a big impact in their brain health in the future?
For sure. I'm very regimented. So for me, it's getting up in the morning, taking a shower, warm first, cold afterward, as long as I can take it. Miami cold is much different than Rochester for sure on cold temperature. Afterward, I read about 20 minutes of something for like personal development, write down goals. My breakfast is nearly the same. So I'll always get like pasture raised organic beef. I'll take a quarter of that, mix it with 3 eggs, quick fry pan with coconut oil, and then I'll have some kind of carb with it, whether it's a rice or some type of toast. There's rare times I'll practice intermittent fasting as well. After that, I do my day-to-day routine, but I try to hit the sun up early in the morning. I want to get the sun in my eyes, to help increase my cortisol level, decrease the melatonin level, which really helps set up the day for stress that you're going to end up getting. Throughout the day, I like to drink plenty of water. Food is very specific on specific times, so I'll take a shake in between. I'll do some lunch. I'll do a shake in between after that, and I'll have dinner. But it's really important. I don't tend to sit down for long periods of time. I think one of the best things I do with my Apple Watch is it reminds me to stand up, and just for like a quick minute around. If I feel like I'm getting overwhelmed, I'll take a meditation break for 10 minutes, or I'll go hit up the beach afterward for a few minutes just to walk out there. And it calms the mind down. It resets your focus and it resets your perspective. I think if you're doing the same thing over and over, you're always yearning for the betterment of something that's coming. But if you can be content with where you are now and happy, it really offsets so many diseases down the line. And we've shown that you can control your epigenetics by just your mindset, right? You don't have to live by, let's say somebody might have some type of bad gene. But if you can be happy, if you can meditate, if you can be journaling, and if you're content, you're really changing your epigenetics from your genes. You're really affecting the way things are affecting your genes. People that have a pessimistic view, a very poor prognosis, they always tend to do worse. It's all mindset. It's really big on mindset. I'm probably one of the few neurologists who believes in the subconscious mind, the conscious mind, because I really think it's true.
Awesome, man. I really appreciate all the questions. I think this was an awesome little podcast.